Alliance and many other cooperative groups around the world wanted to see if we could improve the outcome for patients with a particularly noxious subtype of AML, namely those with a FLT3 mutation. FLT3 mutant AML occurs in about 35% of all AMLs, and there's a high relapse rate and poor overall survival associated with most of those patients. We had a drug called Midostaurin, which inhibits the activating enzyme in question, FLT3. It also inhibits other enzymes as well. We knew from early preclinical and clinical studies that it might be effective, but at least in early clinical studies as a single agent, it wasn't a home run. We sought to combine it with chemotherapy, and there was data both in the test tube and in the clinic that combining it with chemotherapy might be a good idea. But we had to prove it with a big randomized clinical trial that required us to be able to define who had a FLT3 mutation and who didn't. And so when a patient walked in the door with AML, we would take an aliquot of their bone marrow, send it to one of 9 academic labs around the world, and only enroll patients who had a FLT3 mutation. So the primary question was, does adding midostaurin compared to adding placebo to standard chemotherapy improve outcomes? And the top line answer was yes, it did. It met the primary endpoint of improving overall survival. There was a 23% risk reduction of dying if you were randomized to midostaurin compared to placebo. There was also benefits in terms of improvements of event-free and disease-free survival in both censored and uncensored analysis for transplant. The transplant issue was important because 57% of the patients on this trial got transplanted, which is really the standard of care for this type of AML right now. So we were certainly encouraged by the results and hope it represents a new standard of care with this difficult type of AML patient population, and will hopefully lead to its use, number one, in other subtypes of AML, and hopefully spur on the development of other targeted therapies in AML and other diseases.